do you have for him? Where are you calling us from?
I'm calling from Lagos.
Okay, Lagos. We're in Lagos.
K2.
Okay, okay. Dr. Linda is here for you. What question would you love to ask?
Well, not really a question. I just want to say I appreciate your program. Ever since
Oh,
it started, I've really been learning one or two things.
oh,
Thank you very much for this initiative.
thank you very much, Temi Dayo.
All
Have a great day. So, Dr. Linda, someone is saying a big thank you to us for
Thank
having
you,
this.
thank you, thank you, thank you.
Okay, so now let's add to into the discussion proper. What are the things that can cause infertility in a woman?
All right. Now, causes of infertility are so numerous. And
Hmm.
then sometimes too, the scientists have also said that sometimes there are unknown causes. There are
Hmm.
causes that we know that are not beyond human capacity, and there are causes that we do not know that is beyond the sciences. We just can't explain. But
Hmm.
before we go to the causes again, there are types of infertility.
Okay.
Now, if a woman comes to the clinic and she has not had pregnancy before, all through her life, she has never been pregnant. It's her first time that she's saying that she wants to get pregnant, and she has been trying and there's no pregnancy. That is called primary infertility,
Primary
where there's no
infertility. Hmm.
pregnancy. Yes. But if another woman comes to the clinic, she has had a baby, she has had a child, 1 year old, or she got pregnant, but she took it away or something. Well, she gotten pregnant before, and she has nurtured the baby to term and gave birth to that child. And now trying to get pregnant again, it becomes impossible. That
Hmm.
is called secondary
Secondary
infertility.
infertility.
So different couples have their own unique problem. One may have primary infertility where there has been no history of any child, and one might have secondary infertility. So
Hmm.
the causes of these types of infertility are numerous. But we'll
Hmm.
start from the little things before we go to the big ones. Because a
Hmm.
lot of times people come to the clinic and say, oh, maybe there's something wrong, maybe this, maybe this. Let's look inward. Let's
Hmm.
start from the little things that can cause these problems before we start going to the medical conditions. The
Hmm.
first thing is the environmental factor. If
Okay.
a couple comes to the clinic, first off, I would like to say something real quick. When
Okay.
people come to when a woman is trying to get pregnant, it is not only the woman alone. Our society has tagged it to be a woman's problem.
Hmm.
Infertility is not a woman's problem. And to get the best of treatment, it is best for the husband and the wife to be together at the clinic. Because infertility is not for one person, it involves two people. If it's malaria and typhoid, you know it's your own problem. You deal with it. When it comes to infertility, it has to do with two people, and they most must be involved for them to get optimal results.
Okay.
So environmental factors such as pollutants from maybe due to your workplace. Some people work in a place where they produce chemicals. Some people work
Okay.
in a place where they produce different things that can be harmful to the ovaries and can be harmful to the production of eggs and can even be harmful to sperm cells. So if
Hmm.
you know you're working in those kind of places and you've not had children yet, if there are special wear that have been provided for you to protect you, don't see it as too much work. Please
Hmm.
put it on because there's a reason for you to put on all those special gears to
Okay.
help you protect yourself from those harmful chemicals.
Okay.
So if there's a woman that
Dr.
works in
Linda,
a
I would love
place,
you to mention the chemicals so that those listening can know what we're really dealing with here.
well, there are some very corrosive chemicals that are used in production factories. There are people that make paint, people
Okay.
that make tobacco, people that make acids or in pharmaceutical companies where they make some acids or laboratory companies where they make some things that are used in treatment and all. Those
Okay.
kind of places, work in those kind of places, you have to make sure you're putting on your protected gear. For people that work in the X-ray, in the laboratory where they do X-ray, the radiological whatever that comes out from the lab is harmful to men. And that's why if you're a man working in a lab, you have to put on your protected overall to protect your sperm cells from the heat that comes from the X-ray room.
Hmm. Thank you very
So
much.
those kind of environmental hazards can affect fertility.
Hmm.
Another common thing everybody talks about it, even a little boy. One day my little boy told me, Mommy, you're stressing me. Because I told him to come and
I
put
can
on
imagine how he was saying it.
Yeah, it's just 3 years. And you're telling mommy you're stressing me. I think at this point, I'm stressing
Which stress? Do you know what stress is?
because you're just keeping stress.
Hmm.
So everybody knows what stress is. So indeed, yes, it is not rocket science. Stress can affect relationship. I
Hmm.
mean, when a couple leaves very early by 5 in the morning, and because of the whole traffic, they come back very late. Where is the time to be having regular intercourse?
Hmm.
And when you don't have regular intercourse, pregnancy cannot happen
Hmm.
because maybe at the time pregnancy is supposed to happen, that's when you're tired.
Hmm.
And then by the time ovulation is not setting to it, that's when you want to do it. So the timing is wrong.
Hmm.
So stress can affect relationship. It can reduce your sexual desire and thereby reducing the frequency of intercourse.
Hmm.
And for people that are looking for children, it is assignment for you that you must have intercourse at least 3 times a week.
At least 3 times a week. Thank you very much, Doctor. Yeah, this is 21 minutes past 10, and it's still Radio Doctor, your free health consultation program on WFM 91.7. My name is Moji Sol, and I've been talking with Dr. Linda Keku. She's been giving us tips and been enlightening us on fertility, female fertility. And we are shuffling this with infertility. The number to call is 07000 917 917, or you can just text or send a WhatsApp message on 070 317 56537. Doctor, we already know, like, you've given us two types of factors,
Causes, yes.
causes
There are
of
many more.
infertility. So can we dig a
Mhm.
little um more deeper? Can we now discuss things that women can do? Because we already know the problem. You've spoken about stress, the environmental factor. Can we now go
Yeah.
into
Sorry,
what?
Moji.
Okay.
So before we go to the things women can do to enhance fertility,
Mm-hmm.
there are still many more problems that
Okay.
women should know
I
as a result
know.
of fertility.
Okay, I know, but I don't want us to buttress so much on that because we are having our call. Calls are still going to come in, and I just wanted to just give one or two, as a giving one or two of the things that women can do. You can then shuffle it with some of the factors.
Okay.
Okay, thank
So
you.
for when it comes to the stress management,
Yes.
women should be able to manage their stress,
Hmm.
right? Managing your stress means you should try to have proper timing. If you know that leaving for work, there'll be traffic, then you try and leave a little much early,
Okay.
and coming back in the evening, try and leave a little much early. Try to relax, try to find time, and research has also shown that paying too much attention to social media also causes mental stress.
Wow.
So
Some women might not like this because social
I
media
know,
is
I know, I
wow.
know. So if you're always on your phone, then it's high time to, just take a break. At
Hmm.
least 2 hours away from the phone a day, if it
Hmm.
is possible. Just throw the phone in your bag, 2 hours at least. It shows that research has shown that people who do that have less less involvement with stress. Another thing
Okay.
women can do is if you're a woman and you have you're already experiencing little sign of infection, especially on married ladies. I mean, if
Hmm.
you can afford to make your hair, you can afford to buy data on your phone, you should be able to afford to go to a clinic nearby to be able to seek help. So many of us when we have infections, you just go to the pharmacy and buy one or two medications.
Hmm.
Once you have a little relief, you think that the infection is over.
Hmm.
And that thing we think that once we take the medication 1 or 2 days and we have relief, we stop the medication
Hmm.
against the prescription. The prescription say use for 5 days and we stop at 2 days.
Hmm.
So if you stop those medications abruptly like that,
Hmm.
you are causing the bacteria to multiply, and there will be what we call pelvic inflammatory disease.
Hmm.
Those are infections that have not been treated, and before you know it, they start to affect the ovaries, the fallopian tubes, causing blockage. And
Hmm.
once there's blockage around the fallopian tube, pregnancy will be difficult to occur.
Hmm. Thank you very
And that thing
much,
women
doctor.
can do,
Okay.
and that thing women can do to reduce the chances of infertility is exercising.
Hmm.
Exercising is very good for everybody, both male and female. For women that are a little overweight, because being overweight can also cause infertility.
Hmm.
So
Okay.
for women that are a little overweight, exercise is also very necessary. And if you're also a woman listening to me and you've been told that you have what we call the polycystic ovarian syndrome, which is PCOS, women with polycystic ovarian syndrome find it difficult to get pregnant. Most times, you don't even require medication. Your lifestyle of eating healthy, your lifestyle of exercising frequently, at least 3 times a week, can help you reduce the hormones, balance your hormones, and help you to conceive at least within 2 to 3 months. I remember also having the issue of polycystic ovarian syndrome, and I was supposed to be on medication. I took it for a little while, but most importantly, I was able to lose weight. I was exercising and I lost weight. And within 2-3 months of doing that lifestyle changes, I got pregnant.
Wow. You're definitely doing what you're preaching. What you're
I'm trying.
Okay, let's get this guy. Hello, good morning. What's your name? And where are you calling us from?
Good morning, please. I'm calling close to you here. Please tell Dr. Linda, last week or 2 weeks ago, we didn't get her number.
Okay.
Very well.
No problem.
You should call it slowly, please. It should not be fast. That was why we didn't get the number correct.
Okay, no problem. What's your name? You didn't give me your name.
Mr. Sunday.
Okay, Mr. Sunday, no problem. I and Dr. Linda would definitely do that. Thank you very much.
Please, Omoji, let's call it slowly.
Yes, we are going to take our time this time to call
slow-mo challenge.
the slow-mo challenge. That slow-mo challenge. I tried. I think there's a special spirit behind that thing because I couldn't get it. Hello, good morning. What's your name and where are you calling from?
Good morning. My name is Ojokodumi.
Okay, Kodumi Abiod, where are you calling us from?
Okay, I'm calling from Ojoji.
Okay, what's your question for Dr. Linda?
Okay, Dr. Linda, thank you so much. I really, learned one of the things from what you've been saying. My question is, for waiting to get pregnant, and you talk of them doing exercise. I know of a particular lady. She's been looking not to go for some years now, and anytime she's fond of going for exercise, someone just call her attention to it that you shouldn't be doing much stress, or you shouldn't be doing much exercise. Even if you are considered by doing that, anything that does happen, or it might just affect your, your fertility problem, and this is it. Like every human needs exercise. So I don't. She's talking from her own perspective, though.
Okay.
But I've not really had time to really find out how factual that could be.
Okay, so you're asking Dr. Linda that if someone exercising so much can affect her fertility.
Yes.
Okay, no problem. Kindly listen over your radio. Dr. Linda, you got that?
Anyway, I understand that part of the question. So I was going to say it's a myth, but I won't totally say that. Because the athletes are known for over-exercising, right? They over-exercise, they do a lot of things, and they take steroids and all that. Those are the kind of people that you can say that exercise will affect their hormones and all. But it's in all, what is important is creating a balance, and there should be rest in between. So if you exercise every day, Monday to Friday, back to back, without having at least 1 day rest, it's what the purpose for the exercise will now become counterfeit to what you're expecting.
Okay.
If a woman is trying to conceive, it's just good to just balance it. Exercise 3 to 4 or 5 times a week. Have rest. Rest is also important because your body gets to heal, cells are repaired, and once your body is healing, cells are repairing, fertility will occur.
Okay. I want to ask this backup question. Exercising 3 to 5 times a week, how many hours or minutes should it be for those days?
Total of 150 minutes is fine.
Okay.
It's fine on a minimum, yes, for exercising.
Okay, we have
that's like 30 minutes a week, a day in 5 days. So that's fine.
Okay, thank you very much, doctor. Good morning, doctor. This is Joy from K2. Please, I have been diagnosed of fibroid. Whenever I eat, after some time, I notice clot of blood during my menstruation.
Okay. Is that all?
Yes, that's all.
Okay, so clot of blood during menstruation is because your period is heavy
Okay.
And if your period is heavy, your body is trying to compensate for you not losing so much blood, and
Hmm.
it becomes clotted. So yes, if you have fibroids, you'll be experiencing heavy menstrual bleeding, and when your bleeding is heavy, there will be clot of blood. And usually, women, as in the spirit of celebrating the International Women's Day,
Mm-hmm.
it's good you speak up. It's, women shouldn't be left or allowed to suffer in silence. And
Hmm.
indeed, you can have an improved quality of life. So, if this is the issue, you can come to the clinic. We can help you manage the bleeding problem. If the
Hmm.
fibroid is insignificant, the only thing we'll do is just to manage the bleeding problem. You don't have to really do anything because with time the fibroid will go away.
Okay. It's 10:30 and it's still Radio Doctor, your free health consultation program on WFM 91.7. And we are still celebrating International Women's Day all through this week. We have Dr. Linda Keku right over the phone with us, and we're discussing female fertility. She has really given us answers to so many unasked questions. But you can still send your questions on 07031756537. That's via WhatsApp or text. And then you can just call the phone line to speak to her directly on 07000 917 917. Now, doctor, you've given us two treatments that you can give. You spoke about exercising, you spoke about we not stressing ourselves. So can we have more?
Okay. Another thing is age factor.
Okay.
If it's advisable that if you know you're going to have, you're looking at having children, all
Mm-hmm.
right. If you're already married, it's advisable to run it at least within 2 years. So if you have one child now within 2 years, after what health recommends after 2 years, but considering your age, you should know when to give adequate for that. Or if you're hoping that, okay, let me just have one now, then in the next 8 years, because of the nature of my work, I'll have another one. You need to
Okay.
consider age as well because fertility starts to decline after 35. The
Hmm.
rate at which you can get pregnant when you were 20, when you were in your 20s, is reduced at the time you get to 35. And another things are just medical checkup. You know, a lot of women have a lot of medical issues, but they don't know. And at the time they know, it's already too late.
Too late.
Last time we talked about cervical cancer, we
Yes.
said that 2020, a lot of women, more than 85% that have been diagnosed to have cervical cancer, do not know they have cervical cancer until almost at the point of, at the end stage of the cancer.
Hmm.
They don't know. Because when they see little sign of menstrual bleeding, becoming heavy and all, they ignore it and choose to buy more sanitary pads than complaining to their healthcare provider. So
Hmm.
we should have the habit of walking into the clinic, even if it's once a year, to have yourself checked. Because a lot of things, a lot of infertility conditions can happen without any notice.
Hmm.
You may find yourself gaining weight and you know that you don't eat so much, but you're gaining weight. It's a call for concern. But sometimes we just ignore it and say, and people tell you, don't worry, it's happiness.
It's
You're
sign of good
happy,
living.
that's the kind of business. That's why you are gaining weight.
Hmm.
Sometimes you see notice that you start to have facial hair. It didn't used to be there before.
Hmm.
Somebody say, don't worry, maybe it's that cream. It's that face cream you're using that's causing facial hair. It might not be. Just go and check. Because all those are signs of PCOS. All
Hmm.
those are signs of high prolactin level. You may also notice that your boobs are getting bigger or they're beginning to discharge water. And somebody tells you, don't worry, when you are menstruating, it's like that. It's not like that.
Hmm.
Have it checked. All those are signs of infertility. Have all these things checked. So by the time you want to get pregnant, it will not be an issue. If you're
Okay.
having infection, have it treated early. So by the
Okay.
time you want to get pregnant, it will not be an issue.
Okay. Good morning. What's your name and where are you calling us from?
Good morning. This is Anadi Nasiru.
Alaji Nosiru.
Yes, calling from Ikoton.
Okay. What question do you have for Dr. Linda?
Thank you. I want her to talk on issue of resources factor
Okay.
leading to infertility and the influence of vaccine injection.
The effect of
Resources factor.
the factor. I didn't get you well, sir.
Resources factor.
Okay, resources factor.
Oh yes, leading to infertility.
Okay, no problem. Dr. Linda, you got that?
I didn't get. No, 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 no. I didn't get the question.
Okay, he said something about resources factor, the factors that leads to infertility, and I think we've treated two.
Those are the things we're talking about currently.
Okay, can you listen over your radio for more, sir?
Hello?
Hello, sir.
Yes?
Um,
I'm hearing you.
yes, we already spoke about some of it, and we're still discussing it. So kindly listen over your radio for more.
Okay.
Thank you very much. Okay, so doctor, we already
Okay.
have like I think four. Yes, four, even right.
Yes, I already listed being overweight. I already
Yes,
talked about infections. I talked about environmental problems and stress. Those
yes,
are the things that can cause infertility. I also mentioned age. Now, age is not only for the woman, also for the man. That's what we call menopause and that's what we call andropause. Sometimes men think that when they are 70, they can still do as they are doing when they are 30. It's not true. There's andropause and there's menopause, and they all mean the same thing. And this period means when your fertility has declined or is declining. So
Hmm.
age can also affect fertility.
Okay. So
Yes.
we have a question from Rosenjo Olawale Mutiu from Alakpere. She is asking, what can I do to control my spit? It's cluster in my mouth like that of a pregnant woman.
If you are excessive salivation can be due to a lot of problems. The basic one that we know is worm infestation. So you need to go and check, or you
Okay.
need to just do it yourself first of all. And that thing can be hormonal problems. If you have excessive hormonal or thyroid problems, all those can cause excessive salivation. Please go to the clinic and have yourself checked. Don't always assume.
Okay. Thank you. Don't always assume. The time is 23 minutes to 11, and we've been speaking with Dr. Linda Keku. Dr. Linda, this topic, female fertility, is really eye opening because there is so much I'm learning myself too. And it is WFM 91.7. It is Radio Doctor, also your free health consultation program. Hello, good morning. What's your name and where are you calling us from?
Okay, this is Victoria
Okay, Victoria, where are you
calling
calling us?
from Songwater.
Okay, what question do you have for Doctor?
Okay, I want to ask about my uh, menstrual cycle. I've been having this skipping and I'm not pregnant. I
Okay, the
don't know what to do
reception is
because of
not
it.
so good. I got you halfway. Can you repeat your question again?
Okay, I said I normally have this skipping on menstrual cycle.
Okay, your menstrual
My
cycle
menstrual cycle
skips
is skipping. Yeah, so 3 months now I haven't seen it.
three
I want to
months.
ask 3 months and I'm not pregnant.
Okay, Dr.
All
Linda.
right, I guess I got that question. Please listen and I'll give you an answer.
Okay, over to you, ma. Doctor.
All right. So she said for 3 months she has not seen her menstrual cycle. Okay, good. Now, that's what we call menstrual irregularities. When your when your menstrual period is not regular, that means you can come today, next month you won't see it, next month you may not see it, and after 3 months it will come again, and you keep going back and forth like that.
Okay,
Most times, the primary thing that causes menstrual irregularities are, apart from stress, poor diet, and hormonal issues. Of course, when your diet and your vitamins are not there, hormones will not be balanced.
okay,
So you need to check your hormones to be sure of which one is having a problem. Most times when women have prolactin issue, their menses will be ceased. When they have what we call the polycystic ovarian syndrome, PCOS, they experience irregular menstruation.
okay,
So after this discussion, go to your closet, examine your boobs, check if there are any watery discharge coming out. If it's not happening, it doesn't mean that hormones are balanced. You
okay.
still need to go to the hospital and run some hormone profile and have it checked. You can also come to our clinic at 149 Ogudu Road and we will attend to you.
Or you can just follow them at Pink Clinic
Or you can
NG.
follow us.
You can
Yes.
send them a message and they'll definitely reply.
Yeah.
Okay, concerning the question you answered the other time from Rosenjo Lawale Mutiu, this particular
Yeah.
person who says that what can I do to control my spit? It's cluster in my mouth like that of a pregnant woman. Is a male, not female.
Okay, it's a male.
Yes.
So let him first start by deworming himself.
Okay.
If that doesn't work, then you should have his thyroid and all those things checked.
Okay.
Mostly it has to do with his metabolic system. So
Okay.
let him deworm. If it continues, please go to the hospital for a proper check.
Okay. Thank you very much, doctor. Good morning. What's your name and where are you calling us from?
Hello, good morning.
Good morning. Can you speak a little louder so we can hear your sweet voice?
Okay, good morning. I'm an anonymous.
Okay. I can hear you. I can barely hear you. I did have to disconnect if I can't hear you well.
Can you hear me now?
Yes, I can.
Okay, I'm anonymous. I'm calling from Ogun State.
Okay.
Okay, I have a
Ogun State. She's calling from Ogun State.
Okay.
Please go on, Anonymous.
doctor. Hello?
Yes, I can hear you. Go on, please.
Okay, sorry, I want to tell the doctor that last year December I missed my period.
Okay.
In December I took a urine test and it was positive. Then January, 4th of January, I did another test, it was negative. At the middle of January, I saw my period. The same with February, it was invalid. Then March now, which was yesterday, I'm seeing my period. I don't know what is wrong. But I've gone to the clinic and said that I'm pregnant and it's possible I will see my period and get pregnant. But I don't just know because I'm missing my period, I'm still negative today, I'm still positive, I'm still valid tomorrow. So I don't understand.
Okay.
So you're saying that you've gone